Hi, I'm Darren O'Connell. I'm the coordinator for the SHIPS programme. What we're aiming to do is to work with people with a lived experience with homelessness and related issues. We put together a comprehensive training programme which will cover every aspect of advocacy to help people develop their skills to be not just to only be an advocate but to move on and develop their own careers, and that's one of the fundamental things about the project.
My name's Lee Appleyard. I started off drinking, taking drugs when I was about 12 years old. Someone older than me offered me drugs. I thought that basically they were my friends because, you know, we got messed up together and we hung out for those reasons. I now know that they were just codependent relationships and there was nothing actual real about them. It wasn't a real friendship like based on a strong foundation of trust and honesty and understanding and support. That's what I have nowadays. But I eventually progressed through all the party drugs, but when people stopped after the weekend they would go to work, then we'd go into education. I continued to oblivion and it just went on and on. Like my tolerance went through the roof, so I'd need the next drug, the next stronger drug, and that tolerance would go through the roof. And it got to the point where it was crack cocaine and heroin, and the only way that I could fund that, honestly, was by going out on the streets and begging. And I'd gone through treatment and had a lot of support, and thank God for those people that cared enough to, you know, be honest with me and open up about their stories and help me to open up about myself. And one of them was one of my key workers from a place called Forward Leeds. Now she got in touch with me one day and said, oh, we've been sent an email about this place Bevan Healthcare, and they're looking for people to volunteer with something called SHIPS, which is peer advocacy. And I just jumped at the chance because, like I say, I'm trying to get my foot in the door and get into this line of work, so I just thought this would be perfect. And the support they're willing to give me to find my way into this line of work is priceless for me. So I hope that I can do some good. I honestly wouldn't be where I am if it wasn't for people that had their own lived experience and they were able to relate to my situation more than, say, a medical professional who, you know, a lot of the time if I felt like medical professionals thought I was this sort of dictionary definition, just something they read, and it was that I was that black and white, when the complexity of people is just no two people can be the same. Everyone's raised in different ways, they deal with different things emotionally, so addiction for two people can be completely different.
Very many people that are on the programme highlight the fact that they actually are on a recovery journey themselves, and doing things like getting involved in voluntary work does actually help with that.
I look healthy and I sound compass mentis now, but I'm far from perfect. I've still got defects. I've still got a lot to work on. Still a lot to learn about myself. But what helps with talking with other people, trying to help other people, is that it's not just one-sided, it works both ways. So whilst I'm helping somebody else, they're talking about things that I didn't even realise that I can relate to, and I go, oh wait, so that's how you've dealt with it. Oh, I can apply that to myself. So I'm always learning from other people. So I think it's beneficial to be in this role for me to learn about myself and become a better, more rounded version of myself.
If you are in a situation, you know, you're living hand to mouth, you're on the streets, you're not going to necessarily have all the resources and energy and to frank willpower in some cases to actually get through to a doctor, to go down to a doctor. So, you know, again, if you've got that access to that digitally, you can have that conversation, you can have that appointment online. So it immediately breaks down the barriers and enables people to improve their health.
I think that a lack of technology or basic digital skills can be a huge barrier for people that are homeless when they're trying to reintegrate back into society. These are skills they might need for, say, so if you go into like the housing office and you're bidding for a council property, you need to do online bidding. There's going to be things like accessing medical reports, you know, setting up appointments, just engaging with services, or even just registering with services so you can get that support, so you can get help.
All the people who we're working with have all got amazing, complex stories, but the commitment that they are bringing to the project is truly amazing, and you know, it just makes you think. You should stand back and think, you know, these are the people that really do need to be running projects like this, and through this SHIPS programme, that's exactly what will happen.
Before the city was just places I would go and meet dealers. There's even these steps behind me. The last time I was here, I was injecting. I remember being covered in blood and trying to hide it from people walking past. Now this is somewhere I can come and meet people like you and do a project like this. There's restaurants where I can go and meet my friends, my family. There's job opportunities like working with Bevan Healthcare. You know, I get to rewrite those memories, those horrible memories that are tied in with this city. I get to walk around now as a new person and rewrite those memories as good things with opportunities.